So we're considering the calves in supine. Problem with calves in supine is similar to the problem with hamstrings in seated. They are on the table. So if I'm considering patient positioning concepts, the anatomy should be free to move should be exposed, free to move in the planar planes required, and preferably visible. Well, it is not exposed, it is not free to move in the planar planes required, and it is not visible. So it's all obscure. If I bend the knee, the calves are now relatively visible to me. They are exposed and free to move in the planar planes required. The challenge that I run into is making sure that the shin is still, or the tibia and fibula are still. Because I'm in this position, most movement that I'm going to impart is going to be able to move the hip. So I have to consider blocking the thigh and also making sure that the foot doesn't slide. One of the ways to do that is you can use your forearm relatively against their shin. Because the fingers will come onto the thigh, I can control the thigh to some degree, and I can also control the shin, right? So if I move this arm, the whole thing is going to move. If I keep this arm relatively still, I don't need a lot of pressure. I can stabilize the shin, the foot from sliding relatively. Sometimes it'll still slide. And then I can also take care of the femur to some degree. And then it's a push and a pull. In this case, feels like it's about here, most restricted. So as I walk my hand down, there's more restriction on the medial side. I can then transition into splitting the hamstring. So if you saw this in seated, similar deal, I'm going to go in between the heads of the gastroc, and I'm going to check for yield to pressure. I still want to keep my forearm going across the shin to stabilize that shin, to make sure that as I pull or as I push my fingers into the gastroc, that I don't start to slide the foot. So I want to be across the front of the shin again, tibia and fibula. So as I push in there, push in there, push in there, push in there. Where was it? It's about there that seems the most restricted, and it's the lateral side in this case. But it's that yield to pressure. So it's push, push, just walking. Again, making sure that I have still bone and moving muscle. In order to do that, at least when I'm splitting, I have my forearm across the shin. When I'm checking push-pull, I have my forearm on the shin and my fingers on the thigh to try to control the hip.